the AMR Action Fund. Now, that's a broader industry effort.
It's a broader industry effort, yes. And so, as I mentioned, there's about 20 companies involved, both large companies like Pfizer and also smaller companies. And the aim there is really to ensure that we invest in that important investments are made in the development of new antibiotics, which is an area that has been lagging behind in the last few years. And so we really want to make sure that new products are being developed and come onto market as soon as possible.
Now, you mentioned, you feel free to speak to Pfizer's interest and motivation in the subject. You've touched on that already in terms of developing infrastructure there. But you mentioned also at the beginning that for you've studied antimicrobial resistance. It's sort of a topic of great interest. And I was wondering if you could touch on that for your own self a bit as well. What motivates you there?
Yes, well, the one of the things that really hit home for me was that actually my own father was diagnosed with an antibiotic-resistant infection, and we didn't know that at the time. But he was hospitalized, and he went through a succession of different antibiotics before actually then. Finally, he got the treatment that took care of the issue. Now he's 90 years old. He doesn't really have the resistance of a younger person, and so he became honestly very close to a fatal outcome. And so that really hit home for me in that particular instance. And unfortunately, the risk is that if we don't do anything now, we will have more and more of those potential issues.
Certainly something that is worth working on. So, what do infectious disease clinicians need to know about these efforts and their own practice around the world? I mean, there are takeaways, whether you're a clinician in sub-Saharan African countries or a clinician somewhere else, right?
Mm-hmm. Yep. No, absolutely. So so of course, one thing is that antimicrobial resistance is inherent in the use of antimicrobials. So, but what we can do, what is very important, is to delay the onset of antimicrobial resistance as much as possible, and that we can do by using the appropriate antimicrobial in the particular case that is being treated. And so antimicrobial stewardship is incredibly important, and it's very important for healthcare professionals in general to understand this. It's also important for the public in general, and that's why we have launched a number of initiatives as well, where we inform the public in general about the importance of using the right antibiotics, and only when needed. And this is very important because as physicians, and we have all been there as practicing physicians, there is quite a bit of pressure on the part of patients to prescribe a drug that will help. And so it's important also that patients understand, that the public in general understands the problem and why it might be in certain cases advised not to prescribe an antibiotic, and why that helps actually not only for themselves, but also helps public health in general. And I think that's a very important part of this as well. And so we have participated in a number of initiatives, and one of them was a traveling exhibit on resistance, where actually it was in the Science Museum in London at some point. It has been in Moscow. It has been in Korea. So where actually the public in general can actually see what happens when and how resistance can spread with inappropriate use of antibiotics.